everybody. Welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. Today we are going to talk about a very interesting topic, the treatable causes of cerebellar disorders. The treatable cause of cerebellar disorders. Because by and large, people think that if a person has got cerebellar disorder, there's not much treatment to be done and it is only an academic exercise, and just for nosology, persons discuss cerebellar disorders. That's true because there are so many degenerative disorders. It could be Friedreich's ataxia, it could be spinocerebellar ataxia or olivopontocerebellar ataxia, Macaulay-Joseph disease. True, but then there are a lot of treatable disorders. The treatable cause of cerebellum are also there, and therefore as a clinician our approach is of prime importance. Our approach lies in finding out the treatable cause of cerebellar disorders, because the non-treatable cause of cerebellar disorders is more like an academic exercise or for nosology. But from the patient point of view, the treatable cause of cerebellar disorders plays a vital role, because he is interested more in the treatment of the cerebellar disorders and wants to get cure of the cerebellar disorders and ataxia. And therefore, we are going to now emphasize on the treatable cause of cerebellar disorders. Cerebellum. Basically, any movement is done by the corticospinal tract. The gross movement, for example, if I need to button my shirt, bringing my hands and fingers till the buttonhole is done by the corticospinal tract. But the fine tuning, putting the button in the buttonhole and twisting, is done by two systems, the basal ganglia and cerebellum. These are important in the delicate and precise movements. If the basal ganglia gets affected, either there is less movement, what we call as hypokinesia, classic example is Parkinson's disease, or there can be hyperkinesia, where there is excessive movement, classic example is chorea. But if cerebellum gets affected, the precise target, the precise movement gets affected, so there will be either undershooting or overshooting. For example, if we test the finger nose incoordination, they will be either undershooting or overshooting. They cannot alternate groups of muscles quickly. That's why they have dysdiadochokinesia, difficulty in turning the hands and contracting the alternate groups of muscles. They can have ataxia or wide-based, they have difficulty in walking. Likewise, they'll have cerebellar dysarthria. So the basic problem with the cerebellum disorders is that the precision is lost. They have imprecise movements. So clinically, when a person comes with cerebellar disorders, and when we see that the person has got incoordination and imprecise movements, it is a cerebellar disorder. So having first made out the cerebellar disorder, now our emphasis will be on the treatable cause of cerebellar disorders, because that is going to be important from the patient's point of view. He wants to get cure of the disease rather than discussing the non-treatable cause of cerebellar disorders, which are more for academic exercise and nosology. So now let's focus on the treatable causes of cerebellar disorders. The first and foremost, of course, will be intoxication. Intoxication by alcohol. Alcohol is one of the important toxins for cerebellum. In fact, it affects the vermis basically. So when the vermis and the adjoining areas get affected, they have difficulty in walking. They have gait apraxia. They have problems with the trunk also. Since the vestibular nodular node and the flocculus or the vestibular cerebellar connections are not that much affected by the alcohol, they do not have much problems with the eye. Their problem lies more with the walking gait apraxia, truncal ataxia. So alcoholics, basically when they present with cerebellar disorders, we see more of the problems with the gait. So of course the treatment will be to ask him to avoid alcohol. When he starts avoiding alcohol, and if he completely gives up taking alcohol, that itself is going to be a treatable form and a cure for cerebellar disorders. Then the drugs, especially from the neurologist point of view, We give anti-epileptic drugs for epilepsy. We prefer old drugs because they are not very expensive as compared to the newer anti-epileptic drugs. Though the newer anti-epileptic drugs may have less drug-drug interactions like levetiracetam, they are expensive. So still a lot of neurologists prefer the older anti-epileptic drugs because they are time-tested and then they are relatively cheap financially. So when we give anti-epileptic drugs, especially phenytoin, it can affect the cerebellum. In fact, there have been instances when there's a miscommunication between the neurologist and the patient, and instead of taking another drug multiple times, he took the phenytoin many times, and then after a few days he presented with acute phenytoin intoxication. Basically, a lot of imbalance. When the phenytoin is consumed a lot, they'll have a lot of imbalance, ataxia, they have nystagmus. A person having real nystagmus, ataxia, and when we should always ask history of phenytoin intake. An epileptic who comes with cerebellar signs like nystagmus or ataxia, always inquire the history of phenytoin intake, because phenytoin is one of the most toxic anti-epileptic drugs for cerebellum, the others being barbiturate and lithium. Then the other treatable cause of cerebellar disorder is the episodic diamox responsive episodic ataxia. So these are all also responsive to treatment, diamox, acetazolamide. Then infections per se can affect the cerebellum, or after the infection they can develop post-infectious cerebellitis. So infections is always an important cause of cerebellar disorder. Most of the persons will have a viral infection, and either they present during the phase of viral infection or after a few days after viral infection, post-infectious viral cerebellitis. So when there's a history of fever and systemic signs of infection, and then there are cerebellar signs, we should always think of post-infectious cerebellitis or viral cerebellitis. Then another important treatable cause of cerebellar disorder is endocrine hypothyroidism. Hypothyroidism can cause neuropathy, again a treatable cause. Hypothyroidism can affect the cerebellum and can present as a cerebellar disorder. So always we have to think of treatable disorders, because once we treat them they become better, and when we do the thyroid stimulating hormone levels and we find hypothyroidism, just replace with thyroxine and they become better. So one of the important treatable cause of cerebellar disorders is hypothyroidism. Then the other treatable causes of cerebellar disorders are nutritional, vitamin B1 deficiency, vitamin B12 deficiency, and then they have the demyelinative disorders like multiple sclerosis. All we need to do is to give steroids or the disease modifying agents, they become better, because multiple sclerosis is a demyelinative disease which affects the myelinative tracts like the posterior column, because it is a largely myelinated tract. It usually does not affect spinal thalamic tract because it is least myelinated tract. It affects corticospinal tract because it is myelinated, they present with weakness. It affects the optic nerve, they can have optic neuritis. Eighth nerve well myelinated, they can have hearing problems, and cerebellum which is well myelinated, so they can have cerebellar disorders. So nystagmus, ataxia, all these, when a person presents suddenly, you have to think of multiple sclerosis. When a person presents suddenly of a sudden focal neurological disorder, there are only two possibilities. One is vascular, they can present suddenly like cerebrovascular accident, which we see in senior citizens, or multiple sclerosis, which we see in young persons. Because the saltatory conduction gets affected when there's demyelination, they present very suddenly. The other conditions are the, as I said, vascular, sudden onset of focal neurological deficit, either a hemorrhagic stroke or the infarction of the cerebellum. Cerebellar hemorrhage is very common, and especially it is due to hypertension. Hypertensive hemorrhage usually occurs in four sites: thalamus, putamen, cerebellum and pons. Cerebellum is one of the common sites of hypertensive hemorrhage, and we do surgery and we can take it out. Then we have autoimmune disorders where we can give steroids, and then there are some benign tumors which can affect cerebellum, wherein we can surgically intervene and remove the tumors. So when a person has got cerebellar disorders, as a clinician, our prime approach, our main interest will be to find out whether there are treatable causes of cerebellum or not. Because non-treatable causes, we are not going to do much about it, but we should never miss a treatable cause of cerebellar disorder. And if we find out and then diagnose and treat accordingly, we are doing good to the patient, and the patient will have real satisfaction that we have done something good for the patient. So always when a clinician approaches the patient, the treatable causes should be his main concern. I hope you have enjoyed listening to my lecture. If you have any suggestions or comments, kindly post onto my YouTube channel. But please like and subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.